I'm Rashmi Halker Singh. I'm the Deputy Editor of Headache, and it's my pleasure today to be joined by two colleagues, Dr. Peretz and Dr. Smirnoff, who are recent authors of a publication entitled A Retrospective Cohort Study to Evaluate the Efficacy and Safety of Occipital Nerve Blocks in the Treatment of Migraine During Pregnancy. Thank you both for doing this really important work, and welcome. I'm really excited to have this conversation with you both.
Thank you so much for having us.
So, first of all, tell me about your study. What did you do? And also, what prompted you to do this work?
So, a lot of what prompted this work to begin with is, I think, the limitations that we have when treating our pregnant patients. So, a lot of times when we're thinking of treating our pregnant patients with migraine, we think that our options are so limited. A lot of us are already doing occipital nerve blocks in pregnancy, and so this sort of prompted us to look at their experience and see how much pregnant patients were actually benefiting from it. So the purpose of the study was actually to look at both retrospective data and survey data of pregnant patients who received occipital nerve blocks throughout their pregnancies and see what their experience was, see if their pain improved, and see if there was any change in terms of the medications that they were taking.
Yeah.
I concur with all of that. Don't have too much to add, but I think this came up when Dr. Smirnoff was in fellowship here at Stanford, and I recall us talking about the paucity of kind of good treatments for migraine in pregnancy, and this kind of coming up as like this is an area that should be explored better. Why doesn't somebody look at nerve blocks and the data behind it? Because there really isn't that much data, and yet, as Dr. Smirnoff pointed out, we do use nerve blocks pretty frequently.
Yeah, absolutely. I was very excited to see the study, mainly because this conversation comes up all the time with my patients who are thinking about becoming pregnant. And even though I tell them that for many women, migraine does get better, the follow-up question is, what if it doesn't? And what can we do to help them? And what are the options available? And people always want to know about the evidence behind the procedures and treatments that we have to offer. So this is really exciting to see. So what did you find? What were the results of your review?
So when we looked at both the pain and the abortive medication use, we did see improvement. So overall, for the patients who were getting nerve blocks, they were both seeing improvement in their immediate pain, but also seeing improvement in their pain overall over weeks to months. This sort of varied a lot between our cohort because we had a relatively small group, was difficult to really characterize, but we did see improvement in that area. The other really key area that we saw improvement in was abortive medication use. So patients were using actually a lot less abortive medications. The improvement was from 9 to 4 days of acute medication use per month. So we did see improvement in that. And since, we don't really know the safety of some of these abortive medications, this is actually something that I think can be a great benefit to many patients.
And I think we also looked a bit at safety and didn't see any increased signal for adverse outcomes among pregnant patients who receive nerve blocks in pregnancy compared to patients who don't.
So I'm a clinician. I take care of, as you both know, I take care of a lot of patients who live with migraine, and many of my patients are women who are thinking about getting pregnant. How do you think this will add to the conversation between clinicians and their patients?
I think the really interesting observation that we made here is that the occipital nerve blocks were helpful in the acute sense. So they were helpful when somebody's already having a bad migraine cycle, they don't know what to use, but also it was helpful as like a brief preventive treatment. So it can help prevent the migraines or reduce their migraine frequency burden for at least a period of time. And so it can really help us sort of augment our armamentarium when we're thinking about pregnancy in terms of what to use both abortively and preventively.
And I think something that I'm thinking about when I talk to patients is also kind of what's the relative safety of this. And of course, this is a small study, but it still adds a little bit of data to support that this is probably a safe treatment in pregnancy. And so it can be a potentially very effective and safe option for our patients. And it's nice to point to the literature and say we have data to support this now.
Yes.
One of the benefits I was going to say of us doing this retrospectively is that the data for some of the babies that came out of this study was months to years later. And so we have that data on their development and their health. And so we saw that that was very comparable to the regular US population.
Oh, that's really important as well. Yes, this is a treatment that we do in our clinic for many patients, and this is something that's discussed within the headache medicine community as well. And I think your work really adds to that conversation in terms of what kind of benefit patients may expect to see from an acute standpoint as well as a preventive standpoint, the impact on acute medications, and the impact on outcomes from the baby perspective is also really, I think, helpful to the conversation as well. This is, I think, going to be very helpful for clinicians in that conversation as we have with our patients, and also can be helpful to patients as they make their own treatment decisions. Thank you for publishing this. Any other comments that you want to share?
In general, I'm just grateful to see the growth of literature looking at treatments for migraine in pregnancy. There's a long way to go in terms of what we can do to support that. But and you've even seen the International Headache Society supporting nerve blocks, serial nerve blocks, as a first-line treatment for migraine prophylactically. And so it's nice to contribute to the literature and hopefully even have some more justification from an insurance perspective as well, that this is an option, because it can be hard. I think one of the biggest barriers for me, at least, in getting nerve blocks for my patients is whether or not insurance will cover it. So hopefully this helps.
I think the other benefit is that, when we talk to a lot of trainees and even other providers who aren't as comfortable with treating headache in pregnancy, they're hopefully literature like this will make them more comfortable and make them feel like they have additional options. So hopefully there's the education component of this as well.
Wonderful. Well, thank you both for your work.
Thank you.